Good afternoon, everyone. Bonjour. Thank you for being here today for an update on the investigation into a potential New Brunswick cluster of a neurological syndrome of unknown cause. I'd also like to thank Dr. Natalie Banville of Vitalité Health Network and Dr. Édouard Hendriks of Horizon Health Network for being here with us today. The discovery of a potentially new and unknown syndrome is scary. I know that New Brunswickers are concerned and confused about this potential neurological syndrome. I share in that concern. I know that many people in the province feel frustrated, and I understand that too. As of Friday, May the 28th, 2021, there have been 48 individuals identified as experiencing signs and symptoms of a neurological syndrome of unknown cause. As the syndrome and/or its causes have not been identified, we are refraining from using words like confirmed or diagnosed. At this time, the investigation is active and ongoing to determine if there are similarities among the reported cases that can identify potential causes for this syndrome and to help identify possible strategies for treatment. Before I go on, I wanted to take a few minutes to explain the timeline here in New Brunswick. The Creutzfeldt-Jakob disease surveillance system, known to us as CJDSS, routinely works in partnership with the regional health authorities in New Brunswick to detect all types of human prion disease. Through routine case management, the CJDSS noted common symptoms and similar potential diagnostic profiles among some recent New Brunswick referrals to the surveillance system. These referrals tested negative for Creutzfeldt-Jakob's disease, and it became apparent that these atypical referrals represented a cluster of cases that were worth further investigation. In December of 2020, the CJDSS notified Public Health New Brunswick to actively include us in the investigation. The first draft for the potential case definition was prepared at the end of January 2021, and a memo regarding this potential case definition was sent to physicians in New Brunswick on March the 5th. The memo's purpose was to inform and encourage any healthcare provider with patients that may meet the case definition for this neurological syndrome of unknown cause to please contact Public Health, the CJDSS, or the Mind Clinic for more information. In April, Public Health began collecting consent and contact information from those impacted by the investigation to undertake an investigative survey. With input from local and national subject matter experts, Public Health drafted an epidemiological questionnaire to gather information from New Brunswickers suspected of being a part of this cluster. This questionnaire asks for lots of information, including but not limited to the person's environment, residence, potential exposure, and travel history. Detailed information is needed to better understand and may help determine if there is an environmental or infectious source of these cases, and if so, to help identify ways to prevent more cases from occurring. Data collected will be incorporated into the investigation to help identify potential sources of the syndrome. In May, Public Health began calling individuals to schedule appointments to conduct the surveys. The first interview was completed on Wednesday, May 26. To date, 5 surveys have been conducted, 5 more are scheduled for this week, and several more are being followed up on. And to date, despite extensive medical investigation, a diagnosis for the 48 individuals identified in this cluster has not yet been determined. These 48 individuals require additional investigation. At the federal level, Public Health New Brunswick has engaged with the Public Health Agency of Canada, CJDSS, the National Medical Laboratory Outbreak Management Division, the Canadian Food Inspection Agency, Zoonotics Division, and subject matter experts from BC Centre for Disease Control. And public health continues to collaborate with subject matter experts at the provincial level, including the Departments of Environment and Local Government, Agriculture, Aquaculture and Fisheries, Natural Resources and Energy Development, and the Canadian Food Inspection Agency District Veterinarian and the Moncton Mine Clinic. Public Health is working with the Public Health Agency of Canada on data sharing agreement so that all data provided to CJDSS by the Mine Clinic is also shared with us. And today, we are assembled here this afternoon to announce that Public Health is working directly with Horizon Health Network and Vitalité Health Network to implement a joint oversight committee at the clinical and investigative levels. We have started a full investigation into these cases. We are dedicated to reviewing all the case files of those under investigation and have faith that this diligence will pay off. The mandate of the Oversight Committee is to provide expert second opinions on the identified cases, to ensure due diligence, and to rule out other potential causes. This work will involve, but isn't limited, to reviewing the case definition, medical charts, and recommendations for any further laboratory testing if needed, identifying individuals or their proxies that may need re-interviewing, new examination and/or evaluation and further testing, identifying gaps in the electronic medical records and recommending areas for improvement moving forward, identifying potential requirements for further laboratory pathology testing of human samples, including recommendations related to what should be tested for and which samples should be captured, and scanning potentially applicable research. The work of the Oversight Committee will be chaired by Dr. Hendriks and Dr. Banville. I want to personally thank them both, thank both of you for your assistance and your leadership in this most important file. The committee's membership includes Dr. Samad A. Shama, Dr. Byrne Harper, Dr. Lyle Weston, and Dr. Sarah Ironside from Horizon Health Network, Dr. Mario Alvarez, and Dr. Ernest Clevenger from Vitalité Health Network, and Dr. Arifur Rahman, who will act as public health liaison. The Oversight Committee has the ability to seek assistance and expertise from other healthcare professionals when needed. This could include provincial and/or federal behavioral neurologists, geriatric psychiatrists, neuropathologists, neuropsychologists, and/or neuropsychometrists. The expected time frame for the committee to review all cases is 4 months, and approximately 6 to 8 weeks is expected for all patients and families to be interviewed. The timeline will also depend on the availability of neurologists and other experts from across the province and out of the province as needed. Results from this investigation will inform next steps. Due to this investigation, case numbers could also change. Funding for the creation of the Oversight Committee and the review of the existing identified affected individuals will be provided through Medicare, and Public Health will work with the Oversight Committee chairs to ensure any additional expenses are identified and supported. I want to be clear, this Oversight Committee was organized to support the work of the Mine Clinic. This investigation is larger than a single neurologist or even the CJDSS could do on their own. We must all work together to ensure the work is done and the investigation robust. Public Health has been supporting the Mine Clinic through funding for additional staff to help alleviate the workload. Individuals under investigation who have not already been called will be soon contacted to schedule appointments for conduct the surveys. Correspondence is going out to all individuals later today. In the meantime, for more information on current case counts and investigative status, please visit the webpage on the Public Health website. I want to assure you that we will keep all lines of communication open, and when there is more information to share, the Department of Health and Public Health will eagerly share it with New Brunswickers. Thank you. Merci.
Bonjour et bon après-midi à tous. Comme j'ai été présenté, donc Édouard Hendriks, vice-président aux affaires médicales universitaires et de la recherche. Perhaps to add a few information, a few details on what the minister just shared with you. So we have now a clinic at the Moncton Hospital. So for the past few months, we have been working in collaboration with le réseau de santé Vitalité, with the Department of Health, to organize a clinic with different specialists, both on the medical side and on the non-medical side. So these people could provide care, investigation, and whatever treatment is available to the patients that are suffering from potentially that disease. That clinic has been up and running for a few weeks now. To my recollection, when I checked last week, we have over 40 patients that have already been seen by the clinic, referred by other neurologists, family physicians, and Dr. Mario, who followed many of them in his own previous practice. This clinic is comprised of medical specialists from various fields, neurology, geriatrics, but also non-physicians, social worker, nurse, and other people. And of course, we'll have access to all the diagnostic modalities and specialists from both the Moncton Hospital, but also the Dumont Centre Hospitalier Universitaire Georges L. Dumont. So on the clinical side, I think now we have a location where those patients can be referred for further evaluation and investigation, which eventually over time will help to define or to refine the case definition. On top of this, as was discussed by the minister, and I thank her for making me in this role of co-chair, but we have now an oversight committee. And this oversight committee, as was discussed, will have a set of specialist experts, neurologists, most of them, but others, that will be there not to, I would say, substitute themselves to the care of the patients, by the excellent physicians currently in charge of their care, but to provide a second level of expertise, review the cases, make sure that nothing has been missed, provide some further suggestion for investigation or treatment, but mostly will work extensively with the public health sector of the Department of Health in order to find what I would call commonalities between the cases and speed up in such a way access to a diagnosis or a cause and potentially to a treatment. This all help to refine, as I said, the definition of what is this unknown disease. So eventually we are sure that, for instance, patients referred are not suffering for another known disease for which either diagnostic or treatment is readily available at this time. But we really focus over time more and more on those people that seems to suffer for something unusual and undiagnosed at this point in time. So we're quite hopeful that this will help to not only reassure the community and the patient, but also will provide the medical community with access to better tools, better treatment, or better ways to identify those patients. So once again, thank you very much, Minister. Thank you very much for being here today. And later on, I think I'll be more than happy to answer questions you might have. Merci beaucoup à tous.
Bonjour. Comme annoncé précédemment, je suis Dr. Natalie Banville, nouvellement en poste comme vice-présidente aux affaires médicales pour le réseau de santé et vitalité. Je veux remercier en premier lieu la ministre de nous avoir invités aujourd'hui à participer à cette annonce, puis également mon collègue Dr. Édouard Hendriks, avec qui on travaille depuis déjà plusieurs semaines, voire mois, sur ce dossier. Notre travail au niveau de vitalité a été d'apporter du support en premier à Dr. Hendriks pour l'établissement de la clinique à l'hôpital au Moncton Hospital. Par la suite, on a élaboré en collaboration avec la santé publique on a revisé le mandat du comité. On a désigné les membres pour faire partie de ce comité-là. Je crois que c'était important d'avoir des neurologues de plusieurs endroits de la province qui se prononcent sur le sujet ou qui aident un peu à la recherche sur la maladie. Comme on a dit, c'est une maladie non connue encore, avec des symptômes divers. Il y a déjà eu du travail, il y a des patients qui sont identifiés, qui souffrent de symptômes, mais pour lesquels on n'a pas encore trouvé de diagnostic précis. Comme on l'a dit précédemment, il n'y a aucun diagnostic émis. Le groupe d'experts qu'on a mis sur pied est afin d'aider le travail qu'il a déjà fait, d'avoir un œil avec un recul et une approche d'équipe afin d'être à l'affût de tous les fins détails qui pourraient nous aider à faire la lumière dans ce cas-ci. Comme on a dit, on a déjà eu depuis cette semaine la première rencontre du comité, plusieurs rencontres tout au cours de la période estivale. Les rencontres vont se continuer afin d'avoir possiblement des réponses le plus clairement et assez rapidement, quoique dans un diagnostic comme ci, les réponses claires peuvent prendre plusieurs mois avant d'arriver. Mais on va faire nos efforts en travaillant en collaboration, les deux réseaux de santé et la santé publique, afin d'avoir des réponses dans un délai acceptable pour la population du Nouveau-Brunswick. Sur ça, Dr. Hendriks a déjà donné beaucoup de précisions sur le comité en tant que tel. Je voulais vous remercier et on va être disponible pour des questions.
Merci beaucoup, Dr. Banville, Dr. Hendriks, Minister Shephard. Thank you. We will now proceed with questions from members of the media. Each reporter will have one question, and you have the right to pose your question in the official language of your choice. Nous allons maintenant procéder aux questions des journalistes. Vous avez le droit de poser votre question dans la langue officielle de votre choix. Chaque journaliste aura une question. On va commencer avec Sophie des Hôtels, Radio-Canada.
Oui, bonjour. J'aimerais avoir une réponse en français pour savoir quels sont les nouveaux partenaires de cette clinique au niveau canadien et autres, et qu'est-ce que ça va changer, de quelle manière ça va aider à faire ce travail de recherche.
Répétez ta question comme il faut, s'il vous plaît.
Oui, j'aimerais avoir une réponse en français, pour savoir cette clinique, les nouveaux partenaires au niveau canadien, les agences d'inspection, la santé publique canadienne, de quelle manière ça va aider ces nouveaux partenaires ou ces nouvelles institutions qui se sont joints à la clinique de Moncton, de quelle manière ça va aider à la recherche.
Comme dit précédemment, il y a plusieurs partenaires canadiens. On travaille avec l'Agence canadienne d'inspection, Food Canadian l'Agence canadienne d'inspection de nourriture. On travaille avec la santé publique canadienne, la santé publique du Nouveau-Brunswick, la santé publique de la Colombie-Britannique, le département de l'agriculture afin d'avoir toute l'expertise au point de vue des possibles causes environnementales, puis aussi le laboratoire là, pour le centre de recherche pour la maladie de Creutzfeldt-Jakob afin de voir s'il y aurait des choses qui pourraient être reliées ou des choses qu'on pourrait faire le point. Est-ce que ceci répond à votre question? Qu'est-ce que ça va apporter? C'est vraiment une approche d'équipe, d'expertise. L'équipe du Nouveau-Brunswick est sur place. On a accès plus facilement à la population, aux patients, aux neurologues ainsi qu'aux médecins qui peuvent voir ces patients-là dans leur bureau.
Merci, Dr. Banville. Merci, Sophie. Vicky Hogarth, CHCO TV.
Thank you. Hello. I'm wondering if there are any environmental factors that are under investigation right now that people should be mindful of at this time while the investigation is still underway.
Vicki, I'll take that question. No, I think it's really important to keep in mind that, you know, that we can't have a narrow focus here. We must examine any and all possibilities, and as those possibilities evolve, you know, we'll certainly share them with you. But the fact is that the reason that we are going to such lengths with these, you know, with the steering committee and with the investments is that we need to allow the science to do their investigation and their work. And by focusing on any one element could just take us in the wrong direction. So we are going into this with an open mind, and we will look at every potential that may then direct us into another direction.
Thank you, Minister. Thank you, Ms. Hogarth. Justin Dupuis, l'Acadie Nouvelle.
Oui, bonjour. Vous avez mentionné au début qu'il y avait déjà quelques surveys, des sondages qui avaient été menés avec certains des patients identifiés. Est-ce qu'il y a des traits communs ou des choses en commun qui ressortent chez tous les patients déjà, ou il est toujours trop tôt pour tirer des conclusions?
I will take that, but if you wish, Dr. Banville, to follow up, feel free. First off, it's too early to try to get any kind of commonalities from one so few out of the 48 that we have to do. But secondly, as that information is examined, and that, you know, potentially sends us on a more focused path, then that's maybe when we can share information. But for now, we need to let them do their work with the 48 cases they have, and then to examine the potentials of what information that gives us.
Merci.
Comme l'a bien dit la ministre, présentement, il est un peu trop tôt pour avoir aucun lien, puis ça va prendre une analyse approfondie. On est à l'étape du questionnaire, il y a l'étape du questionnaire, il y a l'étape de revue du dossier, de revue des laboratoires qui va s'en suivre par la suite. Donc, c'est tout en faisant le tour au complet de chaque dossier qu'on va pouvoir peut-être arriver à faire des liens par la suite. Encore là, il n'y a rien de certain que cette possibilité-là va arriver au bout du compte. On espère avoir des réponses, mais il est vraiment trop tôt encore pour faire des liens entre tous les dossiers.
Merci beaucoup. Merci, M. Dupuis. Merci, Dr. Banville. Sarah Seeley, Brunswick News.
So originally when all of this news went public, there were confirmed cases and suspected cases. And I was just wondering if that was still the case, that there was going to be suspected and confirmed, or if or are you just kind of lumping them all together at this point?
So Sarah, as I mentioned in my comments, we are going to refrain from using the words confirmed or diagnosed. And the reason for that is, again, you know, we need for the committee and Dr. Marrero to do their work, to start with their questionnaire, which is lengthy, and will contain and will actually give them a lot of information to examine, to put them on a path. And of course, like any research, as they go, if something comes up that's a commonality, well, they'll deal with it as they go. But we can't presume that they have that to go on now. So we have 48 cases that have been funneled to this point, and if more come up, they the committees, I'm sure, the clinical doctors involved here will decide if they need to be investigated in this line. So for now, it is just a matter of we need to work with the 48 we have, and we need to find out what information those 48 can give us.
Thank you. Thank you, Ms. Seeley. Thank you, Minister. Carissa Donkin, CBC.
Hi there. Minister, I just heard you say the number 48, so I'm guessing that is the number that we're still working with, but just wondering if you're able to give an update on the number of deaths, that is still at 6, and if you're able for the 48 number, if you can please break down how many of those people are in the Acadian Peninsula, how many of them are in Moncton, and how many of them might be elsewhere in the province, and if so, where in the province are they?
So at this time, we're not really breaking it down by sector, and that's for many reasons, because we know that this has gone on for a few years, and the information that we will get from those 48 lengthy surveys will help us understand if people are naturally from these areas or if they move to these areas. There's a lot of information that needs to be examined before making some real judgment on that. What we know is that they are not just secluded to 2 areas. We have other cases that are also in this mix, and it would be, I think it would be a short-sighted viewpoint to start targeting areas without understanding what that means. So I think that they have information they need to examine, and then we would be able to give a better picture.
Thank you. Tim Roselle, Global News.
Thank you, Bruce. Just wondering perhaps if the minister can sort of summarize how these case reviews will work. It's already been mentioned about the survey. Are there more aspects to a case review than the lengthy survey, or is that how it's going to start, and then it's just sort of going to veer in a particular direction depending on how the surveys go?
Thank you for the question. I will answer this one, Édouard Hendriks. So the review will be as extensive as possible. So of course, as you heard, this epidemiological survey will be done for every patient and potentially including the families and so on, so we can find, and it's a very lengthy questionnaire, 2 to 4 hours, depending on the cases, just to not unlike what we do for the contact tracing related to COVID, if I might use this example. On top of this, the charts, the medical files of all these patients will be carefully reviewed, just to see what happened in the past, no prior diseases, issues they have, no other neurological problems, and so on. What kind of investigation they had, over time, when did the symptoms appeared, when were they investigated at first, what kind of treatment was used with what kind of potential effect, and so on and so forth. And all these information eventually will be shared with some colleagues, if need be, from instance, PHAC, the Public Health Agency of Canada, with the Creutzfeldt-Jakob identification service system, just to say, okay, do you have yourself some data on such a patient that you can share with us? And all this, eventually will, over time, lead hopefully to identify 1 or 2 potential causes, or perhaps none, or perhaps at some point we'll realize, well, all these diseases, when you look more in depth to them, are related to something which is already currently known, perhaps an unusual presentation, but something that is still, let's say, on the radar, if I may say. So it's going to be a very extensive, comprehensive, lengthy process that hopefully hopefully will help us to make sure that we don't leave anything on the table on one side, but on the other side, that will help us to quickly identify perhaps one or two key factors that may lead to potentially a reason or cause or the identification of some factors related to that illness.
Thank you. Jennifer Bassa, CTV.
Good afternoon. I was wondering if you're aware of more cases coming up with the symptoms of this unknown disease.
It's my understanding that at this time we do not have any additional cases to put into this flow, but you know, the reason that the medical memo went out was to inform physicians in the province of the symptoms and the status of where we are now. So it doesn't mean that more cases won't come forward. At this time, we don't have any additionals, but we're really concentrating on these 48 to get through this to see if it leads us on a path.
Héloïse Rodriguez, Radio-Canada.
Oui, bonjour. J'aimerais savoir qu'est-ce que vous dites aux 48 personnes qui ont ces symptômes et à leur famille parce qu'ils attendent des réponses et je comprends que c'est un long processus, mais qu'est-ce que vous dites pour les rassurer pendant qu'ils attendent d'avoir des réponses, de comprendre qu'est-ce qui se passe?
I'm going to start, and then certainly one of the doctors can follow up. It's very important that the families understand that we are in a methodical process to help them to understand what's happening, and we know that it is an anxious time. We know that that some people have passed away and their families would like to know why, and so we're going to continue forward. And the message is that we will be in communication with them to help them understand the process that's happening. A letter will be going out today to all families and individuals to let them know how this process is unfolding, to give them assurances that they are not forgotten, that we understand they are waiting. And it will take, again, the next 6 to 8 weeks in order to get to each one individually for their interviews.
Édouard Hendriks, si je peux rajouter, je pense qu'il y a deux niveaux. Premièrement, on doit rassurer les familles sur le fait qu'on est en train et on a commencé à mettre en place des démarches extrêmement concrètes, d'une part pour assurer un suivi de leur cas. Comme je le disais, la clinique à l'hôpital de Moncton est sur pied depuis déjà plusieurs semaines, voit des patients, suit des patients. Les patients ont accès à des neurologues spécialisés, ont accès à des gériatres, ont accès à toute une kyrielle de spécialistes et de professionnels de la santé qui peuvent les aider dans l'évolution de leurs symptômes et qui naturellement peuvent avoir accès aux traitements qui sont disponibles à ce moment-ci. D'une part. D'autre part, comme on l'a mentionné, il y a tout un processus d'évaluation et d'investigation qui, on l'espère, va nous permettre au cours des prochains mois d'identifier peut-être un ou deux facteurs. Ceci étant dit, il faut comprendre qu'on fait affaire avec une maladie neurodégénérative. Donc, c'est des maladies qui sont extrêmement difficiles, non seulement à diagnostiquer, mais éventuellement à traiter comme telles. Et je pense que tout le focus doit être mis effectivement sur le soutien aux familles, le soutien aux patients qui en sont affectés dans un premier temps. Et par la suite, on verra ce que la recherche et l'investigation nous permettra de déterminer au fil des prochains mois.
Merci beaucoup à vous deux. Thank you both. Nicolas Steinbach, Radio-Canada.
Oui, bonjour. Une précision et une question. Précision sur la question de Carissa Duncan. Est-ce qu'on est bel et bien à 6 décès et est-ce qu'il y en a d'autres potentiels? Juste confirmer ce chiffre-là. Et la question, c'est Est-ce que vous, parce que bon, c'est une cause environnementale qui est présumée, est-ce que vous avez un message à la population? Parce qu'environnemental, c'est l'air, la terre, l'eau. Est-ce qu'on déconseille de manger certaines choses, d'aller dans certains endroits? Il y a beaucoup de gens qui se posent des questions, qui ne veulent pas attraper cette maladie-là, et comme cette cause environnementale, probablement, est-ce que vous avez des conseils à donner? Donc, précision et questions. Merci.
Bonjour, je vais répondre à cette question. Présentement, comme dit précédemment, on aurait 6 décès seulement. On n'a pas d'autres décès de rapporter pour ce côté-là. Pour la question environnementale, on n'a pas de théorie encore. On est à la recherche. On n'a pas de cause environnementale, on n'a pas de cause génétique, on n'a pas de cause sur des médicaments, on n'a aucune cause établie. On ne peut pas aviser la population de faire attention à une cause environnementale pour laquelle on ne sait pas. On n'a pas de réponse. Le but de l'investigation et du questionnaire de la revue est d'essayer de trouver la cause de ceci, mais on n'a aucune réponse jusqu'à ce présent.
Merci beaucoup. Pascal Rachnog, Radio-Canada.
Oui, bonjour. Ma question est pour la ministre de la Santé. Madame Shephard, j'aimerais avoir vos commentaires sur l'initiative annoncée hier par le réseau de santé Vitalité qui veut rediriger certains cas non urgents vers les médecins de famille et les infirmières praticiennes. J'aimerais savoir qu'est-ce que vous en pensez, puis si vous pensez que ça peut surcharger les médecins de famille et les infirmières praticiennes. On sait qu'il y a déjà une pénurie de médecins de famille au Nouveau-Brunswick.
Merci pour la question. So, the regional health authorities must have the ability to convey their challenges and to take action in order to ensure the safe delivery of healthcare services. It is concerning to me. We have a healthcare professional shortage, and that means that right now everyone needs to come to the table to help us get through a period of time until we can correct that. And we are certainly working diligently every day. Both RHAs are working very hard every day to try to overcome these challenges. But it is important that when they see a potential risk or situation that they need to mitigate, that we help them, we partner with them, we encourage and support to get through any period of time where these challenges, we take a proactive approach as opposed to waiting for, something to happen that we must react to. That's their job, and I have to rely on their expertise in order to deliver safe and reliable healthcare services.
Thank you. We have a reporter's question by text because their microphone's not working. Je vais la lire. C'est une question de Maude Montembeau. Pourquoi c'est important de faire connaître le syndrome ailleurs qu'au Nouveau-Brunswick? Pourquoi cette affaire devrait intéresser tout le Canada?
Ici, l'important, c'est d'essayer d'avoir des réponses. On doit travailler en équipe. On a identifié ça au Nouveau-Brunswick, mais il n'y a rien qui nous dit que ce n'est pas apparu ailleurs au Canada. Donc, le fait d'avoir une approche du Nouveau-Brunswick pour investiguer, mais de travailler avec des partenaires canadiens, c'est pour voir la possibilité que ces petits syndromes-là, il y a plusieurs autres petites éclosions ou diagnostics semblables dans d'autres provinces. Je crois que c'est important d'avoir une approche commune et de collaboration dans un dossier comme celui-ci.
Merci, Docteur. Michael McDonald from the Canadian Press.
Hi, it's Mike McDonald here. Can you hear me? I'm not sure if my microphone is working.
It's working beautifully, Mike.
Thank you. My question is, well, it's kind of a general question. I'm wondering if someone could explain to me, put into context just how difficult the task ahead is. We know that there's going to be a survey that takes 2 to 4 hours, and as far as I can tell, the only thing that we know about this disease is that it's not a human prion disease. Tell me about how difficult this task is going forward.
Thank you for the question. Not sure if it will answer, but let me put it this way. We are facing here what we call a neurodegenerative disease. There are many different diseases that lead to this kind of problems. Think of Alzheimer, vascular dementia, or other type of dementia and so on. So one of the problems is basically all these diseases, they do start pretty much the same way. A little bit of cognitive disorder, some strange muscle movements, and so on and so forth. And it's only over time and during the evolution of the disease that no specialist can say, listen, this seems to be more this than that. That's one thing. The other thing is, for most of these diseases, there's no diagnostic tool. So let me think, you have chest pain, you go to the hospital, well, within minutes, with an EKG and some blood test, they will diagnose if you have a heart attack or not. For most of the neurodegenerative diseases, there's no specific testing. And actually, most of the tests we do is to exclude other diseases. And it's only over time, by exclusion, that people can say, yeah, this looks more this than that. So it's why eventually, the existence of these diseases lead to lengthy evaluation, investigation, and even for the diseases that we know that we can treat, sometimes may take months for a neurologist, if not years, to say, listen, this is truly Alzheimer, it's not another type of dementia, and so on and so forth. So it's why, at some point, it's going to take a little bit of time. We believe that the epidemiological study will help us because, as mentioned by my colleague, Dr. Banville, at this point in time, there's no identifiable cause. So there's no, and I know some people have put on the table, well, could it be this, could it be that? At this point in time, we don't know. Everything is on the table. We're going to look at every possibilities, and hopefully we'll try to develop a good understanding of the disease. As I said, making sure it's not something we already know, but perhaps with a new presentation, and eventually offer better diagnostic and better treatment for the patients.
Thank you, Doctor. Todd Battis, CTV.
Thank you, Bruce. This was addressed in French, but I'll ask it again. Obviously, this is getting lots of attention from across the country, wondering if New Brunswick Health or either of the doctors have heard from other provinces as to whether they are seeing similar cases being, people showing up at doctor's office. And we're talking about 48 individuals, 48 cases in New Brunswick, but I'm wondering if there is numbers beyond that, if there's going to be sort of a national database where there could be Canadian-wide numbers as opposed to individual provinces.
So the simple answer to your question is not at this time. But as Dr. Banville explained, the reason that there is, a national collaboration is because when we have something happening in New Brunswick, we cannot preclude that there won't be something that does come from outside of the province. So what we can say now is that our partners, nationally and or provincially, are all part of this, supporting the Mind Clinic to help understand where we go with this. And there won't be any real path until we examine all of the information from the 48 cases we have.
Thank you, Mr. Battis. Wency Lung, Globe and Mail.
Hi there. Thanks very much for taking my question. I'm wondering, from what I understand, there were 3 brains that were studied in autopsy, and no evidence of prion disease was found. But can you tell us what did investigators see in those autopsies? Thanks.
Go.
For now, we don't have the answer to that. We don't have the result of the autopsy, but that's going to be part of the review that we're going to conduct. And after we did the review, we're going to have answer. And if there's something shown with the result that we think it's related to something, it's going to be shared with the public at that time.
Thank you. Steve McKinley, Toronto Star.
Hi there. Thanks for taking my question. This is for the minister. When I'm talking to families of victims of this disease, the one thing I'm hearing more and more is that they're frustrated by communication from public health. There was a website that hasn't been substantially updated since it's been posted. And you earlier on said that you thought that regular briefings was a good idea. So I'm curious, what kind of commitments can you make to these families that they'll get regular updates on the progress and the process of this investigation?
Thank you for the question, and I do agree that, I understand the anxiousness and the anxiety that families and individuals would have through this process. It's important to note, as I said in my speech, that this came to the department in December of 2020, and in January of 2021, a case definition was determined, and then the work really began. And so it is unfortunate that this cannot evolve in a fast-paced manner because it is not only diagnostic, but it is research. And so it must be done in a methodical way. Now, with regards to communications, I share the responsibility of ensuring that these families are communicated with. And last week, I had asked that a letter be developed to send to each and every family that is experiencing, this slowness. And I think that we need to assure them that the work is ongoing. And as we go forward, those letters will be going out today, and then every family will be contacted with their appointments for their surveys that they need to do. Today's press conference is about conveying to each and every family and every New Brunswicker that we are on a path to try to understand this diagnosis so that hopefully it will lead to a treatment. And we will communicate with families at every opportunity that we can to convey new information or to let them know that it's ongoing. I appreciate that communication is going to be key here for them and for New Brunswickers to know that we're serious about that. And my commitment is that we will certainly be continuing to do that.
Thank you. Thank you, Mr. McKinley. Thank you, Minister. Merci beaucoup à tout le monde. Thank you, doctors. Thank you, Minister. That concludes today's update. Merci beaucoup. Voilà la fin de notre mise à jour. Merci beaucoup à tout le monde.